Hello, everyone. It appears that we have a good number on the audio, as well as most all of you are on the web portion as well, so we'll go ahead and get started. On behalf of the 2016 training course in MCH Epidemiology, I'd like to welcome you to the second of 4 monthly post-course webinars, and this one is Trend Analysis with Dr. Deb Rosenberg. My name is Maureen Fitzgerald, Senior Coordinator for Logistics and Program at CityMatch and Staff Lead for the training course. The course is being recorded for archival purposes and for those unable to attend today. A couple of housekeeping tasks as usual before we begin. First of all, the audio portion. This webinar is beginning with all the phone lines muted, even the presenter. To unmute your phones, this includes our speaker as well, you'll press *7 on your phone, and that's to be reserved for when you want to ask a question if you're a participant. And Deb will let you know whether or not she wants questions during or after. When you're done presenting or asking a question, you can press *6 to remute your phones. And if there's a time that our presenter wants me to unmute all the lines for open conversation, I'm going to give you a heads up before we go ahead and do that, and that is because first of all, we ask you not to place the webinar on hold at any time. If you have to step out, just keep the phone muted or disconnect your phone line and call back in. If I were to unmute the lines, all the lines, and we had 5 people on hold, we would have music drowning out the call. I think you all know that. Also, I want to point out that there's a chat feature on the left side where you can ask a question and you can select a recipient. So if you have a question that you want to ask or troubleshoot, go ahead and type that in. You can direct it to me or to Deb or to everyone. We are recording this webinar, and it will be archived so that you can tap into today's learning, especially people who are not able to join us. And if for some reason you are disconnected, feel free to call right back in and rejoin. So at this time, I'd like to welcome Dr. Deb Rosenberg to open the webinar. Press your *7, and away we go.
Can you hear me?
Just fine.
Okay, very
Maybe
good.
you need to be a little louder.
Louder. This is about, how's this?
It's good.
Good? Okay.
Yeah.
So, hello everybody. This is Deb Rosenberg, and I think I may know some of you, but I'm really happy and thrilled to be doing this because the only difference is that I don't know all of you because typically I've been faculty for the face-to-face part of this course that you all did this year. Of course, in a beautiful place, San Diego, that I didn't go to. I'm sorry I can't see you and that you can't see me, but hopefully this will be useful. You can see that I am Research Associate Professor in Epidemiology and Biostatistics at UIC School of Public Health. And really, I've spent much of my professional life doing this kind of training, and I really love doing it. It forces me to learn new methods and hopefully to have the chance to get those of you really working out in the field to try new things, to do new things, to make the work we do in MCH epidemiology richer and better. So with that said, I actually would love it if people could interrupt me during the talk. I don't want to go, beyond something if there are questions or if you want to challenge me on something or anything. So please feel free to do the unmuting of your phone and just break in. I will not be upset or insulted. I'll be thrilled if you do that. So with that, let's get going. Just a brief outline of what we're going to do today. So a little overview in general of analyzing trend data, and then specifically talk about some issues for using trend data for setting targets and monitoring progress towards objectives, using trend data for program evaluation, for quality improvement. Then we'll go a little bit into some specialized regression approaches for analyzing trend data. That's join point or piecewise regression and NOES regression. And an example of something that I think is still ongoing and was a really useful, instructive illustration of the use of statistics and the vulnerability of using statistics, and that was the example of infant mortality in Dane County. And then at the end, I have some examples in SAS for those of you who really like to think about coding for yourself, doing some of the things that a program like JoinPoint can do for you automatically, if we have time. And if we have time, I'll try and do an example of JoinPoint where I actually go into the program and show you exactly how it's done. Okay. So at the beginning, let's just talk about typical using trend data in general, regardless of the specific purpose, whether it be surveillance, program evaluation, target setting, whatever. Some of the special considerations that we'll touch on then are independence of the observations, smoothing techniques, the time frame and the sample size, and confidence intervals versus confidence bands. Mostly what we look at, and I guess it's still true today, but certainly in the past, mostly trend analysis has really been focused on looking at large populations over long periods of time. So what you can see when I even say that is big sample size in terms of size of the populations that are being studied, but also sample size in terms of the number of data points, the number of time periods that we're looking at. And in our world, the most obvious example is international comparisons of infant mortality or perhaps maternal mortality over time. But more and more, we're really interested in looking at trends for smaller populations or smaller geographic areas, and sometimes for smaller population groups. So again, the sample size issues become more important in both dimensions, both number of time points and number of observations at each time point. There are different purposes, as I've already mentioned. Sometimes we want to just look at the general pattern of change over time, looking at increases or decreases, and we might be doing that for health status indicators or services indicators or systems indicators, so we can do that for a lot of different things in the healthcare arena. Often we also want to compare one time period to another time period, and that's where we get into looking at the impact of a program that was introduced at one point in time, or the introduction of some new medical procedure or new medical practice. The idea of there being a before and an after. It could be a policy analysis as well. When was a policy put into place? We also might be comparing one geographic area to another, and I think we're often doing this in our work, whether, in our states, looking at, urban versus rural, or more refined than that at the county level, or some other geographic unit of analysis. And the important thing here about the advantage of looking at trend data, I've said it provides a fairer area-to-area comparison, and that's because you can imagine that when we just take a snapshot at one point in time, even if the data are really timely. So let's say we can look at 2015 data, but we know that there's just natural random fluctuation in the data. And so what that means is that it could appear that one area is doing better than another area right now, but we'll get a slightly different picture when we actually account for all that fluctuation and take the long view and look over 5, 10, 15, 20 years of data. Maybe we will come to a slightly different conclusion when we see that. We can compare one population to another, and the same kind of notion applies here when we're looking at disparities, which we all want to be looking at. Just taking one simple snapshot in time is fine, but we're going to gain such a richer view of what's happening with those disparities if we can look across time. And then we also may want to use trend data to make projections, and that has to do with monitoring progress towards a national or local goal or objective, and it helps in planning levels of services. And so this is really I'm calling it projections. It could be forecasting. You can think of it that way as well. So multiple uses for trend data. When trend data is based on small numbers, then we're in this world of having to account for the stability of the rates. Not that we don't always have to account for that, but I think it's obvious that when we look at national or international data, in fact, you know that often people don't even present confidence intervals at all when we have trend data based on really big numbers, because the confidence bands around the trend data will be so narrow that it's sort of negligible. But as we go into looking at smaller populations, smaller geographic areas, et cetera, that error in our estimates really needs to be accounted for. When the time period we're analyzing is relatively short, that means we also have sort of instability. I don't know if that's exactly the right word, but it's again, the sample size in terms of the number of data points is small, and it becomes harder and harder for us to really make reliable and accurate estimates. So that has to be considered too. And I know in our field, I know often we may only have 3 data points. How much can we rely on those 3 data points without having a much longer series of data? Okay, what is this? It's just the third bullet point. I'm going, what is this? The third bullet point is just saying, well, the issue of small number of data points is also true for making projections, that it's harder to make accurate projections when you have a smaller sample size in terms of time periods. We also have to be, as epidemiologists, concerned about confounding. And when I say that, I just listed all the things that can happen over a long time period that might impact the trend that we're seeing. And I can give you just an example, even from my own city in Chicago. People always want to look at community areas. We have 76 named community areas in Chicago. They're essentially neighborhoods. They have some historical meaning. The problem is that even in as segregated a city as Chicago, there have been shifts in where people live. So that if we're looking at, let's say, maternal mortality across community areas in Chicago, and we're talking about 20 years of data, we're using vital records data, for example, well, things have changed. And so the community area that I live in now doesn't have the same composition as this same area 20 years ago. So somehow we have to be able to account for that. Actually, you're going to see I use an example just because I'm completely, as I'm assuming many of you are too, I'm completely embroiled in what's going on with this election cycle. And so when you think about the accuracy of poll data and projections about even at a state level, which is pretty big, how is Georgia going to vote? How is Iowa going to vote? How is Alaska going to vote? And you're using historical voting data to do that. Again, what have been the demographic shifts over time, and how can polls account for that kind of confounding so that they actually are making accurate projections? And we'll talk more about that later on. But you can see, besides the demographic composition, just thinking about things like changes in reporting, even changing in the data systems over the past 10, 20, 30 years, and the impact that has on the estimates that we make, changes in programs and policies, etc. So you have to be very aware of that as we're building models to look at trends over time. And then what do we mean about smoothing techniques? We've talked about how you can imagine almost any trend data you look at, and there are fluctuations over time. And we said, well, at a big population level, those fluctuations aren't that great. The sample size at each data point is really big, and maybe we have lots of data points. As we move, again, towards smaller population sizes, smaller number of data points, we need to do something about dealing with the ups and the downs across time and being able to figure out which pieces of those are just random fluctuation and what are the real, how can we account for that and get stable estimates of what's going on. These are, what's listed here are various approaches to doing smoothing. Some of the simpler ones are for health data when we're talking about rates, which are often based on fairly small numerators, but maybe pretty big denominators. But we can think of this as for any proportion or percentage that we're using. Often it's useful to take the natural log transformation of the rate, and that is because if you think about a regular regression line going through a set of data and how we may want to extrapolate beyond the observed data, what happens if we don't do any transformation is we are likely to end up hitting the x-axis at some point over time just by projecting our line, our regression line forward. And we know if we think about something like infant mortality, even, low birth weight, any of our usual MCH indicators, no matter how well we do with developing good programs and policies, we're not going to hit zero. So to avoid that, taking the natural log transform means we never will hit zero. We'll still be able to look at a monotonically, hopefully decreasing trend, an improvement in our data, but we're not going to unrealistically get some very low estimate in the next 10, 20, 30 ever years. We also, I know we do this all the time, we combine years of data as a way of gaining sample size, and that's certainly appropriate to do. That does, in effect, smooth the rates. We gain stability, but when we just combine years of data, we lose some information. So we're gaining sample size at each data point, so we have a 3-year rate instead of a 1-year rate, but now we've decreased the number of data points we're looking at over time. One common approach to solving that problem is to move into doing rolling averages where we gain stability in the rates. We are combining years of data, but it's a way to also preserve the number of data points over time. And then, of course, regression techniques. Regression itself is a smoothing technique, and we're going to talk about how it applies to analyzing trend data. Here's just, and I know for your reference, I think everybody that's on this call understands this, but I just want to make sure that everybody is differentiating when we talk about averages between unweighted and weighted averages. So when I say creating a 3-year rate, I do not mean using an unweighted average where we're literally taking an already calculated rate, taking 3 of those rates and taking an average of them. We literally want to do a weighted average, which is combining the numerators and the denominators and truly having a 3-year rate. And I've just showed you here, what that means and why it's a weighted average, so that we're actually using the denominator of each rate and the total divided by the total as the rate. For something like infant mortality, for example, where the sample size in a state, let's say, is fairly constant year to year, this isn't going to make a huge amount of difference. But you can imagine if sample size changes from year to year, depending on the indicator that you're working with, it will make a big difference. So it's just always the weighted averages. And what I've shown at the bottom is here is looking at just mutually exclusive 3-year averages, so that in this case, in this example, if we have 15 data points over time, 15 annual rates, if I make mutually exclusive 3-year averages, we gain the sample size by having all 3 years combined, but we end up having only 1, 2, 3, 4, 5 data points. So in that sense, we've reduced our sample size for the actual trend analysis itself. So to solve this, we do 15-year rolling, 3-year rolling averages, same rates, but now we have overlapping rates, averages, so we combine years 1 through 3, then years 2 through 4, then years 3 through 5, et cetera, et cetera, et cetera. And so you can see we preserve basically the number of data points that we start out with. Sometimes people do something at the beginning or the end of this series to really preserve everything. So the problem here is that you can see by having these non-mutually exclusive calculations, we've by definition imposed correlation in the data. We're not going to talk here today so much about dealing with that kind of correlation. In our world, I would suggest to you that correlation is fairly negligible, but there are fancy procedures, which are the really formal time series analysis procedures that use moving averages and that also statistically handle the correlation in the rates. We're not going to talk about that today. That's something else that, I think in our world, in our MCH world, we should probably talk about more, but that's not where we're going today. So I guess I sort of said this. So we can use lots of, for regression analysis, we gain stability, we smooth the data, we preserve the information. The only thing is we usually lose the real or observed data. That is if we only present the regression line itself and not the observed data. Obviously, we can present both. And then I said here, if data are correlated, we can use these other methods. And then even regardless of the correlation structure, there are both parametric and non-parametric regression approaches to use. And we're going to talk about a little bit about each kind today. So here's a standard way of looking at a regular linear regression model. And I should point out to you, and we're talking about trend analysis here because I put this year variable as the main effect in our model, but just say that in any linear model, whether you're looking at time trend data or not, if it's a linear model, all of those data coefficients and your testing of them are testing and whether or not there is linear trend, whether it's in time or anything else, whether it's in age, whether it's in some other continuous variable that you're using. So that's the nature of a linear model, is that that's what the meaning of those slope parameters are. We're going to spend our time talking about a model like this where we are focused on a main effect that is time itself. And then what I've given you at the bottom of the slide here is also how you can use that slope parameter to also get the annual percent change out of this linear regression model. And that is often something that we want to report, and that makes sense to people. You know, we're not going to report a beta coefficient. We might say, oh, there was a statistically significant trend based on running a linear model, but often from an interpretation point of view, we really do want to report an annual percent change. So I've just given you the way to calculate that here. It's a simple calculation. Oops. Oh. Okay, there we are. So let's talk about confidence intervals too. And for trend analysis, and for any kind of, again, it could be age, but any kind of regression line where we're running regression, we're really interested in a confidence band as opposed to confidence intervals around each data point, because it assesses the reliability of the entire trend line itself. In other words, it assesses the sort of joint reliability of the whole series of data points. And so now let's look at just some pictures. This is some old but some real data from Hawaii, from Maui, that was infant mortality data. And you can see I've plotted the data, the observed data, and then the confidence intervals around the observed data. And I've asked the question here, what's the meaning of overlapping confidence intervals? And I'm saying that because, and I guess I would love it if someone wants to answer that question for me, because I see people talk about overlapping, and I hear people talk about overlapping confidence intervals a lot. Does anyone want to talk about what they see here and how you would interpret these confidence intervals that you see? No one wants to take the plunge?
Just a reminder, press *7 if you want to take the plunge.
Thanks, Maureen.
You're welcome.
Well, to start off the discussion, what you see here I think is fairly typical when we're doing trend analysis based on fairly small data. So that, remember, this is Maui, so the number of births, annual births, is fairly small compared to, say, in Illinois. And what you see is all the confidence intervals are overlapping. So, you know, should we interpret that as meaning there's no significant trend? Should we not interpret that, or what does it mean exactly? And I would say that pretty much any trend data that I think we're looking at, you're going to see this. You're going to see overlapping confidence intervals. It's going to happen. Okay, well, I will just say, I often hear people wanting to say that, oh, the confidence intervals are overlapping, so there's not a statistically significant difference between the data points. And that's really not correct. we can't conflate looking at separate confidence intervals with actually conducting a formal hypothesis test, because the formal hypothesis test takes into account the joint variation across the data points. So be very careful when you either do it yourself or you hear other people do it, that they aren't the same thing. And it's sometimes just when you're exploring data, it's important to obviously to look at confidence intervals and to understand how wide or narrow they are and whether they're overlapping, but it is not the same as conducting a formal statistical test. So in this case, here I ran a regression model. It's a regular linear, ordinary least squares regression model. And I still kept the observed data. I plotted the regression line itself, so the predicted values, that's the line in yellow, this guy, right, that's the regression line. And then I plotted the confidence bands around that regression line, which are the two blue lines surrounding that. And so there you can see the difference in just looking at the observed data and the looking at the regression results, including the confidence band around that. And when you look at that, you can see that there clearly appears to be a trend. And then the next slide is really the same thing, but I've just extrapolated beyond the data to make it easier to see. So where would Maui, and again, this is old data, but look at where would Maui data, infant mortality rates been once we reached the year 2000, and I put the year 2000 objective there. So regression analysis is really useful and does provide a way of performing formal statistical tests about the nature of the slope of the trend, the shape of the trend. And I'm not suggesting here, by the way, that when you produce a report that, this is the slide, the graph you would produce in the report, or even that this is, you might end up, just forget the confidence intervals here, you might end up wanting to only look at the observed data and then, write some narrative about the results of the regression analysis, because I understand that, for many of the audiences we most care about, maybe we don't want to present regression results, but it's in my opinion, we have to do this work and produce these kinds of results for ourselves as the epidemiologists to actually be able to decide what we want to put in a report and what we want to say about the results. Okay, so again, we have to decide what we want to show, but first we have to do the analysis that allows us to make that decision. The thing I want to emphasize here is that in the case that we just looked at, it actually looked like there was, let's just go back for a minute, that there was a fairly, even just looking at the observed data, you could almost eyeball it and say, ooh, there does look like there might be a monotonically decreasing, which in this case is a good thing, a trend. We often, though, have data that may not show that. The trend data may not, the shape of the trend may be more complicated. There may be some consistent decreasing trend, and then we might see a deterioration over some number of years. We might see more of a curvilinear shape rather than something that we think a simple linear model can handle. And so then we have to think about other analytic approaches that can actually capture the shape of the trend, and we will talk about those. There's also this instance what if we have an outlier? And this is real data too. It's also old. So this is measles cases from 1980 to 1992. This is real. These are real data. I've kind of just drawn. This isn't from eyeballing it. Not my guess that what would a regression line be if I ran a simple regression? And I'm guessing it might look something like that. Finding the best line, the best least squares line through the data, but would that really capture what's going on here? And this is an instance where we don't want to smooth the data because what we want to understand is what was happening in around 1989, 1990, and in fact there was a sort of measles outbreak at that point in time that was important for us to be dealing with. So it's not always, it just stresses the importance of always looking at the observed data, drawing pictures, looking at tables, never jumping to some analytic method that you have in mind that you want to do until you do all the preliminary work first. Okay, so let's talk a little bit about some specific uses for trend data, and let's start talking about setting targets and monitoring progress towards objectives. And I think this is really important for us. We've all the states have just finished their, annual reports and their block grant application, and did the needs assessment a year ago, and now we have national and state performance measures, and we have strategy measures, and we have the whole ball of wax. And we need, I think, to do a good job in figuring out how we set targets for our states, or for even more locally if we're working in a local agency, and how we monitor progress towards objectives. This is one example of just saying, well, we could use regression analysis, and we could say, let's just extrapolate our data. Let's say we have an ongoing trend, and we want to see where will we be, and this is kind of what you saw in the Maui data example. So that would be that, just extrapolating the trend line beyond the observed data. Or another approach is if we want to accelerate our progress toward an objective, if we're not doing so well, and we know that we want to target lots of resources towards improving a certain indicator, there's new programs being started, et cetera, and a lot of interest and political will to actually do something about a particular issue, we can actually force the slope to be steeper, to actually look at an accelerated rate of change. And we can actually do that, we can fake out whatever software we're using, whether it's something as simple as Excel or even in SAS, something like that, and force some hypothetical data, including putting in the objective itself as a data point in the data, and finding out, okay, what's it going to take, and where should our target be even a year down this road? Where do we want, is the target right there, or is the target right there? It's a useful technique for thinking about, us really controlling and conceptually deciding on how challenging or not a target should be. And I will tell you, having just reviewed another block grant this summer for a state, the target setting that I usually see when I review annual reports and the block grant applications is pretty weak, I will say. And I always talk to states about it because it's like, okay, how did you set that target? And what was the systematic approach that you used? And usually there's sort of a little bit of chuckling and eye-rolling and, well, you know. So I'm just arguing strongly for a more epidemiologically rigorous approach to thinking about target setting. Here's another example. If we look at our trend data, and we do what we always do as epidemiologists, but we stratify our data and look at the trends for smaller population groups within our total population, and we might see a picture like this. And then we have to think about, okay, are we going to just use the crude, unstratified trend line as a way to set a target, or are we somehow going to, is it meaningful for us to think about, you know, maybe like what's going on in this group here, which seems, or what's going on in this group, which was doing better and is doing worse now. It's a way to look at disparities, and it's a way to think about somehow incorporating what we know about disparities into our target setting approaches. And I don't have time today, but there are ways without, I'm not suggesting that we should have, you know, population-specific targets. I don't think we should have multiple targets. But even thinking about how we come up with an overall target for the whole state, I think we can challenge ourselves to incorporate what we see over time for different population groups and how we come up with that target. And again, I don't know if you talked about this in San Diego or not, but anyway, it's another discussion, but I'm just suggesting to you that it's not always just appropriate to use the crude, unstratified trend data as a way to pick a target value. How about this approach? This would be looking across all of our indicators. I've just used 3 here. Use the regression analysis to project beyond our observed data, and for each indicator and a corresponding objective that is relevant for that indicator, to project out to where we anticipate that we can meet that long-term objective. In this example, I've said for indicator 1, we're not going to meet the objective till 2026. For indicator 2, we will hopefully meet it in 2021. And for indicator number 3, we're doing a better job. We're going to meet it in 2019. And you can imagine having a listing of, we have so many indicators in MCH, somehow incorporating this into the priority setting process and thinking about allocation of resources and program development, et cetera, and thinking about, okay, well, we need the most improvement here in indicator 1. If we really want to meet the objective in a reasonable period of time, what is going on there compared to, say, indicator 3? Maybe historically we've focused more on indicator 3, and maybe we need to shift some resources more to some other indicator. Here's an example where we also think about more than one indicator at a time, and we use trend analysis to look at the different shapes in the trend line. Here again, I'm just assuming, you know, a monotonic change over time. So for indicator X, it looks like we started out much higher than, we were pretty far from the goal for X, but we're on a pretty good trajectory. We have a ways to go, but the slope is certainly showing improvement. If we think of, let's just assume that going down is good in this case for these indicators. For indicator Y, when we look historically, we were actually closer to the goal for Y, but we haven't made much improvement, and in fact, perhaps there might be some deterioration over time, right? The slope looks like, if anything, it might be increasing. So, and because of that increase, we're actually, if this is 5 years down the road or whatever, where the goals are, that we might actually be worse than the goal when actually back in time we were closer to the goal. So how can that information be used for both setting targets and thinking about where resources should go and what we should be doing to make sure that we're on track for both of these indicators? I sometimes like to do a little cross tab like this or a matrix where I look at the intersection between the general sort of summary of what's going on with the trend and where it is in terms of a long-term goal. So the rows are the nature of the trend over time, and then the columns are the distance from the goal. And you can imagine filling in the cells with just lists of indicators. You know, where is infant mortality in your state? Is it improving but we're still far from the goal? Then you'd stick infant mortality there. Is it improving and you've actually surpassed the goal, you've already met the goal, etc. And you can use then the cells, if you want, to think about, okay, you know, what's the worst case scenario, right, is down here, the trend is worsening, and you're still far from your goal. What are those indicators? And the best case scenario is, of course, the top leftmost cell where you've already met some long-term goal and you're still improving. The trend data is showing you're improving. To me, this is a way of, you know, in our, I guess what I always find daunting in our world in MCH is we are looking at so many indicators simultaneously. We have multi-dimensional things going on, both in terms of population groups from women, infants, early childhood, adolescence, transition to adulthood, women of reproductive age, and within each of those population groups, so many different indicators. So I am always craving finding ways, something like this, I'm just throwing out ideas for you, where I can impose some kind of systematic scheme so that I don't get paralyzed just looking at the reams of data that I have. Okay, what about program evaluation? We want to compare trend lines before and after program implementation. Sometimes we might have just one group. Everyone got the program and we're just looking at a before and an after. Sometimes we have more than one group, and that could mean only one group got the program and we have a comparison group, or maybe we have two groups that got the program, either two different groups meeting maybe in two geographic areas, or sometimes we might have groups that are getting slightly different versions of the same program. You know, one has this enhanced set of services, one has a slightly different set of interventions, and then maybe another comparison group that didn't get anything. So we might have the trends that look different or the same both before and after the program. So let's look at what this might mean. And these are just completely hypothetical graphs. These are not, I'm saying they're infant mortality rates just to give us a frame of reference, but I just made up the data, so don't get caught up in the actual data points themselves. So this was, what if a program had been implemented in 1999? What do we see and how do we interpret it now that we're going through, just through 2006? So we have one group that got a program in 1999, and, well, so I said no obvious change in slope. This, you know, maybe we want to do some formal testing here. I mean, it does look like even before we were on a slightly downward trajectory, you might argue that that trajectory was changed a little more. unclear, and without any formal statistical test, I don't know the answer to that. What about this picture? This is clear. It's still one group. It's pretty clear that the slope has changed after the program started. Wouldn't we love to see data like that? Usually our data aren't quite this clear, but that's another picture we would hope to see. Here's two groups. A couple of things we want to notice here. Excuse me, I had to cough. A few things we want to notice here. When the first thing we want to look at is, well, in the two groups, whatever change is going on, it seems to have happened equivalently in both groups. In other words, I would say it this way, the trend lines are parallel to each other, both before and after the program. Both groups seem to have this change in the slope or the trajectory of change or the rate of change after the program starts. Actually, without being told, you really don't know just by looking at this who got the program. I think we often, well, I don't know, who got the program? I mean, you can't immediately tell right here who got the program. So one group certainly started out with higher rates than another group, but in terms of who was actually given the program, it's not explicit in this graph. How about this one? There is a possible change in the slope coincident with the program start, mostly for the group that's the pink line, right? This is obviously a steeper trajectory, but actually we still don't know who got the program. There might be secular change here, right? This group might just be doing better for a whole host of other reasons, unrelated to our program. We really don't know. But something different is happening between the two groups, so we would have to investigate further for the reasons for that differential change. Here's another example. This time the group represented by the blue line, the top line, seems to have a steeper slope after the implementation of the program. And in fact, by the end of the time period, well, there's crossover just in that 1 year. Actually, this is a great example. Let's see if I can do this. Of if we just looked at data for 2006 without program data, without trend data, we might say, oh, the blue group is doing better than the pink group, and without having the historical information, how accurate would that statement be? So because there's crossover here, actually there's a lot of improvement for the blue group, but historically their rates have been worse than the group represented by the pink line. Okay, and then this one, also another example of some crossover, and in this case, the blue group is actually, for a number of years, probably the last 5 years or so, looks like has improved and is doing consistently better than the group represented by pink. Which group got the program? What are the both secular and intentional reasons for any change over time? That would be our job, and obviously we could think about running regression models, accounting for confounding variables, etc., that would maybe answer some of these questions. So let's talk about how we can model some of those changes. And what you saw in those pictures are the various kinds of changes that we look for when we do program evaluation. This is also, in the quasi-experimental or the social science world, sometimes we talk about these kinds of analyses as interrupted time series analysis. So was there an immediate change after the intervention was implemented? And that, statistically, we were talking about a change in the intercept in our models. Was there a change in the slope? So that's, are those changes after the program was implemented parallel or not to what was going on before? Was there both a change in the intercept and the slope? And did these vary across our various groups? So here are just very simplistically what we're talking about here, and that you saw in those other graphs, but more kind of hypothetically here. This is just a change in the intercept, so you can see all of a sudden we go down, but the slopes themselves are parallel. This is just a change in the slope, but not in the intercept, and this is a change in both. Okay? In epi terms, by the way, start thinking about how would you describe confounding an interaction when you look at these pictures. We'll talk about that maybe, hopefully, if we get to it a little bit later, but how we think about those in terms of time of trend data. Now let's veer away for a minute, then we're going to get back to regression, but I want to briefly go through thinking about trend data for quality improvement, which is a lot like trend data for either just surveillance or for evaluating programs, but it does differ in some important ways, and I've listed some of them here, which is there's this idea of the continuous ongoing data collection during an initiative. It can, and therefore the data can be accessed and displayed in real time as you move through a QI project. You're collecting data and you can look at it month by month or week by week, however you want to do it, quarter by quarter. The time intervals are typically shorter than when we're doing program evaluation or certainly surveillance. So days, months, quarters. Sample sizes are small. Usually these are clinical samples. Not typically comparison groups. We're just looking at patients. We're just, looking at patients with a particular condition, for example. There's usually not formal statistical testing being done, and we're usually more focused on processes as opposed to outcomes. In the QI world, we talk about run and control charts, which are the trend graphs. And the run refers to a consistency in points. And what does that mean? But, the location of data points, and often the rule of thumb is something like 5. So points that are contiguous over or above an average. So are we monotonically increasing or decreasing? You're going to see some pictures in a minute. And the control chart is really like the run chart, except it adds limits. We might add confidence limits. Sometimes people use the interquartile range, whatever, but some kind of limits that represent what the expected variation might be in those data points. And here is the way that, and I've given you the source for this, so you can read more about this too, but this is some of the 4 rules. So you're looking at, is there a shift in the data over time? So here we have everything above the average. Here's everything below the average. Here we have, but the slopes here, by the way, don't look like much is happening, right? They're fairly flat. It's just they've shifted from above to below. Here we have actually monotonically increasing, monotonically decreasing. Here we have maybe too much up and down and fluctuation. And here we have this idea that we looked at before of one outlier point. So these are not that different from what we just talked about in terms of if we were talking statistically, is it a change in the intercept? Is it a change in the slope? Are the slopes parallel or not parallel? In epi terms, is there confounding? Is there interaction over time? So the words are different. The way that each discipline uses these and talks about and interprets these kinds of pictures is somewhat different. But I think you can see there's a similarity in the kinds of changes over time that we would like to assess. Here's some examples then. This is Minnesota data. This is WIC data. And this is data that they produced, and this is observed data from a quality improvement project. So it's a run chart. And, you know, what do we think about? There's this set of data points and this set of data points. To me, it looks pretty much like there has been a shift from above the average to below the average. Here's from, I know a lot of us worked on the non-medically indicated deliveries less than 39 weeks gestation. And this was some really great work that Florida did in their perinatal quality collaborative. And I really like this graph because they not only showed the shift over time, and this is now months on the x-axis, but they showed us a bunch of things at once. They showed us whether the delivery was with induction or whether it was a cesarean delivery, and combined, and just said, okay, is there a downward trend, which is what we want to see, and it looks like bigger slope in cesareans than in inductions, right? But looks like lots going the right way. Here's data from Ohio, also on early elective deliveries, a little different way of presenting the data. Same idea though, right? What do we see? And this one is also because it got stratified for looking at those with private insurance and then those with Medicaid. And did we see different slopes, different change over time for the two groups? Also a really nice, I think, really nice graph. And here's something we did here in my group, and just to say, this was really early on. We've done more now, but I just wanted to point out a few things to you. For one thing, we only had 3 years of data, 2010, 2011, 2012, so how reliable is that trend? I will just say. And then we divided, because our hospitals, I mean, we were, right, this is making change in the birthing hospital level, so our hospitals wanted to see how, for each hospital, how they compared both to Illinois overall and to we have regionalized perinatal care in Illinois, so how they compared to their perinatal network. So you can see this was one particular hospital. This was the perinatal network, so a group of hospitals that they relate to, and then this was the overall Illinois rate. And that was very useful to them. It gave them a sense on where they were in terms of their closest peers, and to the state overall. We've done this in different ways also as well, but this was just one simple way that we looked at our data. And that I've just given you some bullet points here, and it's really just me being on a soapbox because I sort of react to being disciplinarily siloed, and so I would like to think, and I think this is happening nationally, that the QI world and the Epi world are much more intersecting now, for sure in MCH, and I think that's a really good thing, and that I think that we have, as Epis, we have a lot to contribute to that world. So I've just listed them here, and you can read them on your own. I'd like to now go on to talk about some special regression methods that I think are really, really useful for trend analysis. And the first one, we're really going to talk about join point at the end, which is kind of a form of piecewise regression, and I give you some SAS code at the end, but right now I really want to focus on join point. The idea here is that we want to find those inflection points, the changes in the slope of a regression line that we can't do with our regular regression, linear regression approaches. So we want to know if those inflection points might have to do with program or policy implementation. They might have to do with clinical practice. In QI work, that is what they are. They might have to do with change in risk status or change in demographics, like we were talking about. So it's also useful. Join point is also useful not just for trend data, but we'll actually see an example of that. But we're mostly going to talk about it here in terms of time trends. So here are the citations. So the join point regression program is incredibly user-friendly, easy to use, free. It was developed by the National Cancer Institute, so I've given you the link, and I've given you a methods paper and a citation for using join point, etc. here. So quickly, just a summary of the methods. This is uses formal hypothesis testing. So what have we got here? We test hypotheses that look like what I put in the box at the top here, with a null hypothesis that starts out with the minimum number of join points that we hypothesize, and like all nulls, it's going to be 0, right? So at first we're going to say there are no inflection points. There's just a monotonic trend of some sort. And then in the program, we can specify the alternative hypothesis, which is the maximum number of join points that we want the program to test. And typically, I usually do 2, maybe 3. Unless you have 25 years of data with fairly short-term data, you're not going to expect more than 1 or 2 join points. And what happens is that there's an iterative process of testing and retesting the null hypothesis against different alternatives. So if the null is rejected, the null gets respecified by increasing the number of join points. If the null is not rejected, then the alternative is respecified by decreasing, and that process goes on and on until we land on a result. And I've given you here really oversimplified examples. So we start out with the null hypothesis is 0, and I said the alternative is 3, but the null isn't rejected. So we say, okay, how about the null versus maybe 2 inflection points? Still the null isn't rejected. How about the null versus 1 join point? Still not rejected. So what's our result? We never rejected the null hypothesis, so there are no inflection points. We have a monotonic trend. There we go. So here it's just kind of a flip of that. Start out in the same place, null of 0, alternative of 3, but now the null is rejected. So now we're going to test 1 versus 3. It's rejected again. Now we're going to test 2 versus 3, and it's not rejected. And so we end up saying, oh, okay, there's 2 join points. That's an oversimplified, but I think fairly intuitive and clear version of what's going on here. And you'll see that when you get output from the program, it gives you all the results of all that statistical testing and what's going on in the background. So here's just, again, a made-up example. So here's a trend with a single slope, and there's no change in the slope over time. And so you can see at the top here on the graph, it tells you 0 join points. And over here, it talks to you about the annual percent change, or the APC, but you can actually get that on a different tab in the data numerically. So this is actually just like cut and paste, or copied and pasted out of the join point results. So here's what I got for these data. So you see, it said there's only one segment, right? Because there was no inflection point. It went from 1995 to 2011. Here's the APC, the annual percent change. And I just put from many slides ago, I did the calculation using this beta coefficient for the actual slope. I just wanted to show you how I could replicate what join point does for you automatically, so you don't have to do it by hand, but just to be clear on what's going on in the background. This is how the annual percent change is calculated. Here's another example where I've obviously, because these are made up data, where I've purposely made it so there would be a join point, and again you can see that here it says one join point. You can see it's right around here, and in fact you can see here it shows you the two segments, and it shows you the annual percent changes, and if you go to the next output, you get something like this, where it shows you the different segments, it shows you the different APCs, and then it gives you this average annual percent change, which is actually using all the data combined. And I've done again, I can get there, I've done on this slide, I've calculated both the change for each of the segments up here. Here are the two segments, let's say before the inflection point and after the inflection point, and then the average annual percent change, which is really just taking it's a weighted average across the whole range, in this case taking into account the number of data points that were in the first segment and the number of data points in the second segment. And again, you don't have to do any of this by hand, you're going to get it in the output. So here's another example, and this is real data, so this is better for us to look at. And this is something from a real QI project that I helped with. So this is the percent of very low birth weight infants below the 10th percentile for head circumference at discharge. And this was an initiative around better, for these high-risk infants, for some better practices in feeding during the early days and weeks after birth. And what I've given you, because when you run the join point program, it will tell you what it thinks is the best regression model, but you as the analyst can see every version that it ran. So what I've put here for you in the slide is the zero join points at the top, and then this is 0, and then 1, and then 2 here, and I actually said to you, which solution did the formal hypothesis test pick as the best solution? Anybody want to venture here? What do you think was the best model? You can see the observed data. Look at the observed data points and see what you think. If you had to draw a line or lines through the data, how would you have drawn that? Boy, I wish I was in the room with you. Well, so the best solution was this one. That actually was statistically significant. Even in this one, with 0 join points, you could still argue that the quality, looking across this time period, there's steady improvement, right? And it's not as though here's the interesting thing, where this join point is, this isn't where the intervention started. The intervention started back here, so it's not like a before and after the intervention. This might be, I mean, as we've talked about it in the collaborative, it might be how long does it take for implementation to really show results? Like in this time point, there's a lot of provider education going on, lots of other things going on at the hospital level, and maybe we don't really start seeing improvement till several months after implementation. In other words, there's a lag, and that's really important to know too. And then even here, just descriptively, even though this inflection point wasn't statistically significant, maybe the people working on this initiative, maybe something else was going on there. That maybe wasn't enough to reach statistical significance, but might be important in terms of understanding the effectiveness of the implementation or the strategies being used in the implementation. Why does it seem to be getting better and better and better? Lots of questions that could be asked and answered descriptively, not having to do with statistical testing. Here's another example that's real. This isn't with time data. This, as you can see, the x-axis is age here. And before I'm going to show you final results in a minute, but I wanted to show you intermediate results as join point was being used to explore what was going on. So in this graph on the left, it's comparing two groups. Each group was identified as having one join point, so one of them is here, right, where the colors change. One of them is here. So each group has one join point, but it's at a different age, in this case age. What does that mean? In this version over here, we've got one join point there, and we've got a join point here, and we've got two join points. So in one group, we got one join point. In another group, we got two. How do we interpret that? And in this case, we're looking at disparities. So how do we talk about disparities, and how do we think about what we can do about them? So here are the final, one graph of the final results. And this project was led by my colleague Amanda Bennett, who's the CDC Senior MCH Epi assignee here in Illinois, and she just presented this in Philadelphia. Some of you may have even been at that session. So here's her final graph. Oh, and actually, because one reason I wanted to point this out, you just go back a slide for a minute. Look at the x-axis. It actually looks like as we were exploring data, we actually changed how we were inputting age. What were the age groups? How were we coding age for the analysis? And we made after doing a lot of exploratory work, we made a final decision. So you can see what the x-axis is here. You can look at how a beautiful presentation of the join point results. So this was actually severe maternal mortality rates by age and race ethnicity. So we were looking at disparities across age. And here's just on the right-hand side, you can see I put a few quick interpretive kinds of things. So again, there was only one significant join point for non-Hispanic blacks, whereas there were two for non-Hispanic whites. Disparities seem to widen with age. Remember, this is severe maternal morbidity. Risk doesn't decrease for younger black women like it does for whites, so you can see that for white women, there's a little bit of this kind of, U-shaped curve. That's not really so true here. There's only a consistent increase amongst blacks, and the increase for black women is much steeper. So this part of the line is of the slope is much steeper for black women than for white women. So this is not time trend data, but join point was a really good method, and I would say to you that imagine this as being data over time where you're looking at black-white disparities or any other disparities you might be interested in, and being able to actually think through where did things change and what was happening at the particular point in time where it only changed for one group or another. Was there a policy change? Was there a program change? Was there some other kind of change going on that it can explain what's happening with not only change over time, but change in the magnitude of the disparities over time? Maureen, I just want to ask you a quick question here because I have been watching the clock and I can see how late it's getting, and I would really like to go past 3:30 Eastern, 2:30 my time, but I don't know whether the participants can do that or not. So,
how about we do it this way? Let's just keep going, and the participants who have other obligations and have to drop off can drop off at 2:30 or as needed, but we'll just keep going.
Okay. I'm going to keep going through slides, and okay, 1 second. Okay. I am going to keep going through my slides, and then if we have time, I would like to do some join point in real time presentation. But let's stay here for the moment.
Particularly, Deb, because we can record, where it's being recorded, then if anybody who has to drop off, they'll still be able to catch this on the archive. Okay, great. Thanks a lot.
So let's talk about low-S regression, and I saw this done this way, what I've got in the title, just so you know what the low and the S is, okay? So the locally weighted, it's a locally weighted smoothing technique. I just want to give you a caveat before we do this. I am not an expert in low-S regression, but I'm becoming more interested in it as I see more examples of it. So what you're going to see here
Deb, are you still there?
Oh, you can't hear me? Now can you hear me?
Yes.
Oh my, but you know what? I think it threw me out of the conference and it had to throw me back in. I don't know. Okay. Sorry. Okay, so that means you haven't heard about 30 seconds worth, do you think?
Up to, yeah. Mm-hmm.
Okay. So I was just giving you two caveats before we move on. One is the state of my own knowledge and understanding about low-S, which is still fairly primitive. So I'm just giving you a really brief overview here, and I really want to go on and work with this more with some data of my own so I get a deeper understanding. So you're just getting my current understanding. And secondly, that there are other procedures besides low-S. I'm using low-S here because I've seen some really interesting examples with it, but just know, I mean, you can go into SAS and look in the index or in the search about other smoothing approaches and other non-parametric regression approaches, and there are lots of other methods that we might want to be looking at in terms of doing better trend analysis. And so for right now, I'm just focusing on low-S because I have some examples, but I wanted to say that to you. So it's not at all the be-all and end-all. It's just another approach. So it is locally weighted smoothing, and it's a non-parametric method, although it actually turns out it really combines both parametric and non-parametric approaches. So the first part of this method looks for neighborhoods of data points. So you imagine you've got your observed data over time. You've got a bunch of observed data points over time, and it looks for neighborhoods of data, and it identifies neighborhoods, and then within a neighborhood, it actually uses a parametric, meaning a linear regression model with all of its assumptions and everything else about means and, standard errors and all of that within a neighborhood in that subset of points, and draws a trend line within each neighborhood. And then it goes through an iterative process and kind of smooths across all the neighborhoods. So it is kind of similar to join points in that, again, you're looking at whether it's before and you're looking at least implicitly for those inflection points, except that in LOES we're using a clustering technique to identify those neighborhoods of points that should be together and another neighborhood that should be together, essentially defining the space between the neighborhoods is kind of an inflection point, but it's not talked about that way. And by clustering, if any of you are familiar with that, so I believe LOES uses either like the K-means method, it's like a nearest neighbor clustering method, and we don't have time here to talk about those, but again, it's using distance measures to look at distances between and across all points, and it looks for points that cluster together and then calls them a neighborhood when it gets a set of points that are closer to each other than they are to other points not in that neighborhood. So here's one example, and you're going to notice here that a bunch of examples that I'm showing you are from the 538 website, which is the Nate Silver's website. And I've given you all the links. He is an incredible methodologist, and I really recommend you go to some of these links. They're totally about methodology, and he uses LOES regression a lot. But aside from the method, there's a lot to be learned in reading his examples of handling polls to, project results into the future about all of the issues we've talked about how different polls have to be weighted differently, about how confounding and other kinds of, covariates have to be dealt with over time, and how different other kinds of adjustments are made to his trend lines, et cetera. I've learned a lot, let's just say that, and if you enjoy him, it's done in a pretty user-friendly way, but he also has a lot of sources and other citations, so it's a great way to find other things to read. So this first example is just about support and opposition to same-sex marriage based on national polls, starting using 1996 as a starting point and using polls from pollingreport.com, and they've done LOES regression. So you can see that it looks sort of similar to a join point result in that this kind of looks like an inflection point, and as, you can look at all these differences. This looks kind of like an inflection point. Maybe that's an inflection point. And each group, those opposed and those supporting, may have different inflection points, but they're fairly similar. But you can see that they're more smooth. So it's not just a linear regression line and then another one. You can see, because it's an iterative process, that things get smoothed and it looks more like a curve than the simple join point results. Let's see here. So here's also, this is Nate Silver, but I just wanted to give you his steps. This is directly, I stole from his site, the process, the 4 simple general steps they go through, not simple at all, weight and average polls, adjust polls, combine polls with demographic data, so again, this is like dealing with covariates, account for uncertainty, simulate the election thousands of times. And within, if you go to this website, within each step, there's like pages and pages of defining for you what this really means at each step of the process. So I gave you a little bit of that detail here, and in red is just really but you can see this is all part of step 2. So this is about how they adjust and get to a final trend line. So here you can see the first little bit in red over here. The model takes comparisons and draws a trend line from them using lowest regression, and the polls are adjusted based on that regression, et cetera, et cetera. And then the question is, how much smoothing to use in the trend data? This is down here. How much smoothing to use in the trend line? Less smoothing is a more aggressive forecast. So this is true for us too. It's not just about the polls. When we think about whether it's how many or how few join points, how much or how little smoothing in general, how many years of data, even back at our simpler surveillance methods, should we do rolling averages based on 2 years of data, based on 3 years of data, based on 4 years of data? How much smoothing is too much? How little smoothing is too little? How do we make those choices? And he has a great discussion of the way to think about that. And actually, I didn't highlight this, but if you just read this, so empirically, using more smoothing early in the race and less smoothing late in the race works best. In other words, the trend line starts out being quite conservative and becomes more aggressive as election day approaches. And, he will tell you all his assumptions and why that's true and show you how he came there. And here's the example of both an aggressive, more smoothing and less smoothing if you look at these two, the aggressive and the conservative trend lines, and how you can end up getting different results at the end. And this is him just changing his model, and I think it's quite interesting when we think about just everybody else in the world, every other media outlet who's conducting polls of their own, and who's in the sample, who's not in the sample, and what kind of smoothing techniques are they using, and how are they accounting for uncertainty, and are they accounting for other covariates, and are they dealing with demographic changes, et cetera, et cetera, et cetera. So this was back before Labor Day. I think it ends, in August or just before August. So, the conservative line still has Clinton ahead by about 2 percentage points, while the aggressive trend line has Trump up by 1 point. And if you remember, and if you are like me, that was very interesting right around Labor Day that some polls were showing that Trump was actually ahead. So, we don't have quite that kind of data, but it's really a point about us making sure we're clear on our assumptions, that we think through all those questions about what smoothing technique to use, what not to use. These are what I've listed here, sort of all the things we have to think about trend analysis, particularly when we have small sample size at each data point or shorter number of years. So again, if we're looking at infant mortality since 1950, some of this isn't going to matter so much. If we're looking at national data, we're going to have tight confidence bands. We're not going to have a lot of random fluctuation, et cetera, et cetera. But as we do the real work that I think we want to be doing in MCH, smaller areas of geography, looking at disparities across different groups, et cetera, then all of these issues really become important. Okay, let's go through this example, and I'm going to do it pretty fast, both because of time, but I think maybe because now many of you may be sort of aware of what was going on. But I think it's really instructive because these people, this is not at all a critique. These people, the people in Wisconsin who were doing this work, did really thorough, rigorous, good work. And yet, they still came to some conclusions that haven't held up. So I think it is, as I said, a cautionary tale for all of us as we do this work. So here was the first just sort of typical looking at these were 3-year rolling averages, looking at infant mortality rates for the entire state by race, ethnicity, over time, a kind of typical trend graph, initial trend graph for surveillance. Here is low-S regression that was used for both Wisconsin overall and then for Dane County, which is where Madison is, again using 3-year moving averages. So now you see a different picture of what's going on, and the most striking thing you see is this slope right here, what looks like a real significant precipitous drop in the Black infant mortality rate, starting, what do we think, in, 2002, 2003, something like that, something around here. This group also, this is them, this isn't me, using joint point regression. The group began to suspect that maybe it had something to do with the rate of extremely premature births amongst African American births in the state. And so this is a graph from joint point, and it actually showed no, a declining, a monotonically declining rate, but no join points there. So again, they're doing a really thorough job. And just to say that at that beginning, when the first graph with the precipitous drop, this got a lot of play. It was in CDC was called in. It was in an MWR. It made national press, and everyone was really interested in, well, how could this be, and isn't this great, and what can we learn from Dane County? And then as time went on, you see here the racial gap in infant mortality rate returns. Health officials, puzzled by the mixed picture, say they will investigate every infant death and hope to expand home visits to pregnant women. Schlenker said the county's racial gap has returned, with 3 times as many Black babies dying before their first birthdays as white babies, a chasm that vanished from 2003 to 2007. And I love this part. It's not as simplistic anymore, Schlenker said. This has become very complex, which I think is the truth. And then it keeps going on and on. Rate dropped for a bunch of years, but it shot back up again. And and Schlenker said he thinks that the positive trend was real. So it wasn't like they did something wrong analytically, that those estimates, that they were decent, accurate estimates, but that the pattern also has recently changed. And this just, goes on and on with this, and they've continued to look at these data, and I keep trying to update this, and I think one of the best things about all this is that you can see how this wasn't just about data for data's sake. This has all become connected with program and policy. They've started a more intensive FEMA process. They've looked at other programs, including home visiting and safe sleep, et cetera. So it's very much the data being put to use in trying to not just understand, but figure out the right actions required required to actually improve the disparities and improve the outcomes for African American infants in Dane County. So this was just more programmatic stuff. Just keep going. But here again, this was they've actually, and I've given you the link up here at the top, a really fabulous report, I think, of infant mortality. And included in that report are some low graphs having these low S regression. So here's, on the left is the graph of infant mortality by race. And here, the black line is the green line. So you can see what low S identified here was this precipitous decrease and then a change and increasing again. And much more fluid up here, right, than for other groups. Partially, of course, sample size, but the methods are taking sample size into account. And then this figure on the right is preterm birth by race. And so you can see not the same pattern, right? This is, the lines aren't, the smooth lines aren't completely parallel, but they're not like what's over here, right? So there certainly looks like there's still a steady decrease in preterm birth amongst Black infants. So, all of this, I think, really good work, really good trend analysis work. So what I'm going to do now, because we are running out of time, I just want to point out to you, I'm not going to go through these slides. So this is, I just wanted, for those of you who really like to do your own coding, the next set of slides are about doing piecewise regression and SAS, and we're not going to go through these. I just want to say, it's basically doing joint point regression, except when you're doing the coding in SAS the way I've done it here, when it's called piecewise regression in SAS, you have to pre-specify, so you're hypothesizing where those inflection points are. You have to create a variable that assigns where that inflection point is, and then you can test hypotheses. So you can iteratively, you can keep changing how you've defined where the change point is. But as opposed to join point, which actually looks across the whole range and for you in the background, iteratively tries to define where those join points are. But anyway, you'll see there's a bunch of SAS code here that you can look at, you can use. I hope I've annotated it decently. Totally available if anybody wants to email me, talk to me about this, whatever. But I think most of us, to be honest, I did this coding because I wanted to see for myself how it worked. But, I'm using joint point regression. So what I'd like to do instead of going through those slides is doing a very quick example in joint point that gets us back to the quality improvement data about very low birth weight infants born at 10th percentile for head circumference with real data. So I'm going to share my desktop, and let's hope that this works. So, can everybody see my desktop? I hope I don't have anything here that shouldn't be here. Just Maureen, somebody tell me they can see my desktop.
Absolutely.
Okay. So here's join point next to SAS, of course. So I'm going to open join point. Stop me, Maureen, or anybody if you can't see what I'm doing or you need me to enlarge something. Let's see, I could make this, I can certainly enlarge. Is that better if I enlarge it?
Yes.
Okay. I just don't want to make it too. Okay, so you can see you can input, this is basically the way I input data is from Excel that I just saved to a text file. So join point will read, like comma delimited, et cetera, those kinds of files. So this is the file that includes, you can see here's let's see, can you see my cursor? So can you see when I'm highlighting something, Maureen?
Yes, absolutely.
Okay, good. Okay. So you can see that this is just months of data here. This is the count of infants that are in the less than 10th percentile at discharge. This is the total number of infants, and then this is the already pre-calculated monthly average. Remember, this is hospitals in a QI initiative, so we're averaging across all of those hospitals. And then I pre-calculated standard errors of those averages. So that's what I'm going to use here. Sometimes data, you can organize your data in whatever way you want. Then you can see, what type of data do you have? And it says run type, provided in data file, and that's true. You could, by default, it says I have age-adjusted rates, which I don't. So I click on, and I'm just saying because I'm looking at these data, I have proportions. So you can see, I could have calculated, somebody multiplied by 100 and it was a percent. I could have used that, but I said proportion. My independent variable in this very simple analysis is month. So the time variable, because I'm looking at trend data. Then down here, I'm going to actually tell it the variable name. So here, the proportion is in the column HC for head circumference, discharge monthly average. I've pre-calculated the standard error, and it's called standard error. So I've told it that. Then I just want to, before I go on, well, I always leave this the default, but you can see you can either use untransformed data, and they show you the kind of model they're going to run, or use the natural log transform, and JoinPoint has this as the default, and I leave it as the default. But you can obviously change that if you want to change it. And then I go to the Advanced tab, and the only reason I'm really going here is because here's where I can specify minimum and maximum number of join points, and it's fine, I think, to leave it to. In fact, with small sample size, I've noticed if I try and ask for like 5 join points, it would probably crash if I ran the model that way. A lot of this other stuff in the advanced thing, I'm counting, to be very honest with you, I leave the default selections. I really haven't investigated, gone deep enough into the methods to know under what circumstances I would want to change the default. So there you have it. So I've specified everything. If I were going to be comparing groups, like I was going to look at disparities or something, and I had another variable in the data set that defined those groups, then I would be down here, it says by variables, so like stratified by, and I would just hit the add button, and it would show me again a list of the field names, and I could add whatever I wanted to there. But we're not doing that this time around. So I'm ready to go. I'm going to go into session, and I'm going to say execute. And here are the results. And you've seen these results. So what comes up by default is the model they think is the best model. If you look up here, you can see it says join points 1. That's because it chose that model. But we can, and we can look on, I asked for as many as 2 join points, so I can look at all the other graphs. Before we do that, I just want to say the cohort, there's nothing here right now, because that has to do with groups. So they're, using Epi lingo, cancer lingo to, for, what they call this, I would call this groups or something like that. So if, for example, if I was doing race ethnicity, it would have done one set of graphs for non-Hispanic whites, one set of graphs for non-Hispanic blacks, one set of graphs for Hispanics, etc. And that's where you would see that. But we have nothing there. So let's stay with the model that they picked first and just go through the tabs. Here's the graph that you've seen. They re-show me the data just to make sure, nothing got messed up. Here's the regular regression analysis. And so you can see this is what we're used to looking at, the general parameterization. So you see 2 intercepts and 2 slopes, and all the statistical testing here, and you can say, and if you will look at the graph again, so the slope for segment 1 was not significant. It was for segment 2. So when we go back to the graph, this slope was actually not different from the 0, right? This slope, it does look like it's going up, but that's just by chance. But this one was a significant slope, and that's how I tell that. And if I then go to the Trends tab, here's where you see for segment 1 and segment 2, it calculates the average percent change and shows you confidence intervals, all of that. If you go to model selection, this is where it kind of shows you how it decided how many join points. So actually the p-value here looking for 2 join points actually was close, but not significant, right? Okay, come on, get out of there. Maybe get there. But here we have, I don't know what, here we have a significant value for that, for having 1 join point. Let's go back for a minute. Let's go to the graph. And here you can just see, like if we had said no, there's having 0 join points. And it will also then show you the data again, the regression results if you only had 1 slope, right? And it's a significant slope again. Here's the p-value. But is it as rich a description as if we let there be 1 join point? So, and then it'll show you the overall APC over time, etc. So this is pretty, the hardest part, to be honest with you, is, and even in these data, I might redo this analysis because sometimes trying to figure out what's the right standard error estimate isn't always so simple. You can let join point calculated as well, depending on what kind of data you have. So as the analyst, you just have to be really aware of, so back to here, when you're doing all of this, you just have to, start feeling comfortable with all the choices you have. If I chose, let's see if it'll show it for me here. What if I said crude rate? It used to, let's see. Well, it's not, up here you can see you actually can tell it if there are correlated errors or uncorrelated errors, if you want to use a parametric model or a non-parametric model, etc. I thought that maybe that was in an earlier version. Maybe it's, if I don't say calculated from data file, so if I said, for example, if I had not pre-calculated everything, I could have done, I could have done the numerator and then the denominator, right? And if I don't have an adjustment variable, I think I just leave that blank. And, because this is cancer, it wants a standard population, whatever. So there are different ways that you can, different kinds of data that you can feed into join point. And so you just have to be familiar enough, or if you're like me, it felt easier for me to do a lot of the pre-calculation in Excel rather, since I can't quite see what join point is doing. It felt better to me to actually have that already in the data set, ready to feed into join point. So I think that's it for the very quick tour here. And let's get back to Ready Talk. And so I know I've left us 0 time to talk, which is not a good thing.
Would you like to open for questions, Deb?
I'm happy to answer questions.
Okay. Oops, I pressed the wrong button. Well, we'll try this.
The conference has been unmuted.
There. So I've unmuted all the lines. If anyone has a question, please feel free to ask.
And again, my email address is on the first slide, and I'm more than happy to talk to anybody about any of this, whether it's on email or if you want to set up a phone call or if you want to send me some example data if you get stuck doing something. I know, I'm pretty sure all of you on this call are pretty, you guys are pretty good analysts already, and so, but whatever you think would be useful to you, I'm open to that.
Okay. At this time, I think we'll close it down, Deb. And
that's fine.
Thank you so much. And it looks like a good number of people, stuck around for the extra opportunity with you. I appreciate the participants. I appreciate you, Deb. So we did record this, and the link, including an email, will be coming out a little later this afternoon with the recording as well as a link to the survey. And as you know, we really need you to complete the survey. We need that data. And we'd like you to join us again on Wednesday, November 16th for small area analysis with Dr. Kristen Rankin. If you have any questions, contact me, Maureen Fitzgerald, at CityMatch. Have a great day, everyone. Thank you. Thank you, Deb, and goodbye.